Bismillahirrahmanirrahim. Assalamu alaikum. Our spine is composed of different curvatures, and these curvatures are basically for balance and flexibility purposes. Increase or decrease in these curvatures can cause a lot of muscular or structural issues in the spine. One problem which we face is the flat back syndrome, or the loss of lordosis in the lower back. The loss of lordosis can be because of degenerative disc diseases. It can be because of disc compression, fractures, or it can be because of ankylosing spondylitis. Nevertheless, bad posture can also cause flat back syndrome. So when there's a flat back, that means that the person is not able to stand for a very long time. It causes fatigue, and it also causes pain in the lower and the upper back, because the loss of lordosis in the lower back, that also causes the humpback in too many patients. That means that the whole spine is in stress, muscular and structural stress. So that can lead to pain easily most of the time. So it is very important that we maintain the right posture of our spine, especially when we sit. So it is very important that we choose the right chair, or we choose the right device so we can have the lumbar lordosis back. So from orthotic point of view, I can offer two type of devices which can help people with flat back syndrome or people who have lost lumbar lordosis. One device which you can use for the sitting purpose is the firm lumbar support. So these are lumbar support which are really very firm. That means they will not collapse easily. They will keep your lumbar spine supported, or they will maintain the lumbar curve. When the lumbar curve is maintained while you are sitting, that means there's no progression and there's a less muscular and structural stress, and most importantly, the upper back is also relieved from the stress. So you can use a very firm density lumbar support while you're sitting in the car or you're sitting in the office chair, and it is very, very useful in most of the cases. The second option is the seat wedge. Now, seat wedge is very effective, and basically it tilts the pelvic anteriorly. When the pelvic is tilted anteriorly, then you have lumbar lordosis. In fact, you have increased lumbar lordosis. So when you have a lumbar lordosis, then your upper back is corrected automatically. So the seat wedge, that means you can keep the thick part posteriorly. So it is called a posterior seat wedge. It tilts your pelvic by 15-20 degrees more than normal. So it enhances the lumbar lordosis, and it corrects the upper slouch posture or upper increased thoracic kyphosis. So this wedge is very easy. It is anti-slip, and you can simply place on your chair where you sit. It is also called the secretarial chairs because they are lean forward, so it helps them to basically position themselves comfortably. These anterior seat wedge can also be, the posterior seat wedge can also be used as an anterior seat wedge for people who are wheelchair bound. So the idea is it prevents slipping from the wheelchair, but it also causes excessive hip flexion and also stress on the lower back. So you have to decide case to case by using these wedges. But if you have a flat back syndrome, or you have lost the lordosis in the lower back, then the posterior seat wedge is a very good device you can try, and you'll find it very relieved for your spine. So a lumbar support or a seat wedge can help you to control your miseries of flat back syndrome, whether they are stress or any pain. Thank you very much. Stay blessed and healthy.